Well, we're sitting here inside of the hyperbarics room where we have the hyperbaric chambers, but I don't really understand the way that the hyperbaric chambers work. So kind of dumb it down a little bit for us and explain why it works and why you use it.
Well, dumbing it down's easy for me. Basically, the patient lays on the gurney. The patient goes into the chamber. We then pressurize the chamber to about 2.5 times the pressure that we're at right now. During that time, they breathe 100% oxygen. That does several things. For wound healing, it will get a lot more oxygen to that wound, even if the patient's circulation is not terrific. And you need oxygen to heal wounds, and over a period of time, usually 20 to 40 treatments, you'll see a lot better oxygenation. We can measure that before we start treatments and even during treatments with an instrument called a transcutaneous oxygen monitor, which will give us a number and allows us to quantify how much oxygen they're getting and if this was actually going to be beneficial or not.
Okay. When I know that it's treated for, or hyperbaric is used for wounds, what kind of wounds are we talking about? Are they anywhere on the body? How deep do they need to be?
The vast majority are diabetic foot wounds. We also treat threatened flaps and grafts. The main goal is limb salvage. We're talking about serious wounds that are down to the level of tendons or bones, and the alternative is amputation. And so we're trying to prevent that as much as we can.
See, and you also can use the hyperbaric chamber also for burns and for carbon monoxide poisoning. What else can you use it for?
Again, carbon monoxide would be another common use for it. We also use it to treat people who have had radiation therapy for cancer, and they can get what's called delayed radiation necrosis, which is basically a breakdown of their tissue over time because of a lack of blood flow and oxygen. And hyperbarics is pretty good at reversing that.
So typically, if someone, before they start hyperbaric treatment, I'm going to assume, and you can correct me if I'm wrong, that the wound you've been working with the wound trying to get it healed for quite some time. Is that correct?
Yes. It may have been done at another facility or at the doctor's office, but if we see a wound that is serious enough or limb-threatening, then we can do a vascular evaluation and we can start hyperbaric sooner rather than later. Mm-hmm. There's other wounds that we may try to heal with more standard measures first and then use hyperbarics if that doesn't work.
Okay. Now, I understand that you're new to the Valley, which is very exciting for our Valley to have you. Tell us where you came from and a little bit about your history and of your practice.
Born and raised in Texas. Before I moved here, the farthest north I'd ever lived was Fort Worth. My wife and I raised 5 kids, and they're all out of the house, and we decided it was now or never to see a different part of the world, and this is pretty different than Texas, and we're loving it, the climate and the mountains and the people.
Great. And what did you do? And I'm assuming that you had a lot of experience, working with wounds in Texas, correct?
I did emergency medicine for over 20 years, and then got old and did some training in hyperbarics, and now I've been doing that for about 6 years now, and love it.
It's great. It must be very rewarding to be able to take someone and improve their quality of life by healing a difficult wound.
Patients are usually very grateful, and that's what I like.
Yeah, that's terrific. Well, we're thrilled to have you here in the Valley. We're thrilled that Logan Region Hospital has been able to expand the wound clinic and to make this hyperbaric center for our Valley and for anyone else that needs to come in and use it. We're just thrilled to have you as well and have your expertise.
Glad to be here.
What's been the greatest thing so far about being here at Logan Regional Hospital?
Just the support I've gotten from the administration, and the staff has just been wonderful. I couldn't ask for a better place to work.
Well, that's exciting for us, and I'm happy for you, but it's very exciting for us that we now have this facility that can help the quality of life here of our residents of Cache Valley. Thank you so much, Dr. Nell.